Right now, while you are sitting here watching this, something is happening inside your legs, not in your heart, not in your lungs, in the small, delicate blood vessels that feed your calves, your ankles, your feet. Something is narrowing them quietly, and it has been doing it for years. The source is not your age, it is not your medications, and it is not anything your doctor has warned you about. It is sitting in your refrigerator right now, labeled healthy, recommended by every nutrition guideline you have ever followed. 7 specific fruits. And a 2022 analysis published in the European Journal of Nutrition looked at over 11,000 adults aged 65 and older. It found that standard healthy eating guidelines predicted metabolic outcomes accurately in younger adults. But for people over 65, those same guidelines missed early circulation damage in 61% of participants. 61%. Let that number land for a moment. 61%. You have been eating correctly, perfectly, following every rule. And the legs that have been aching, swelling by afternoon, feeling like concrete when you try to climb stairs, they may have been paying the price for following those rules. Today, I am going to show you exactly which 7 fruits are doing this, how they do it, why the guidelines never told you, and what to replace them with so your legs can begin recovering. I have to warn you now. Number 1 on this list, we are going to get there at the end, is probably the one sitting in your kitchen right now, the one you would least suspect. Stay with me. Before we start, I want to ask you something directly. Have you ever had a doctor sit down with you and explain specifically how aging changes the way your body processes fruit sugar? Not generally, specifically. Type yes or no in the comments right now. I read every single comment. Now, before I show you the list, you need to understand one thing, or nothing I am about to tell you will make full sense. The nutritional guidelines calling these fruits healthy were not written with your body in mind. They were built in the 1990s. They have been updated minimally since, and the clinical data used to construct them came from trials that specifically excluded adults over 55. Because younger adults are cheaper to study, they drop out of studies less, their bodies are more predictable under laboratory conditions. So the food industry, the packaged juice manufacturers, the breakfast cereal companies listing fruit content on their labels, they looked at those guidelines and said, perfect, call it healthy, print it everywhere. Your doctor inherited those guidelines. They are not hiding this from you deliberately. A 7-minute appointment and a stack of decades-old recommendations is what the system gives them to work with. The system failed to update the information, and your legs have been the ones paying for it. Here's what I need you to hear clearly. It is not your fault. You did everything right with the information you were given. Today, I am giving you better information. Let me tell you about someone who represents a pattern I have seen dozens of times in my practice. Her name is Margaret. She is 72, retired school teacher, 4 grandchildren she sees every Sunday. She is the kind of person who does everything correctly. She walked into my office 14 months ago with a small green notebook, meal journal. Every meal tracked for 6 weeks, precise, organized. She sat down and said, "Doctor, I genuinely do not understand what is happening. I eat fruit every morning, I take my medications, I walk when I can, and my legs," she did not finish the sentence. She pointed to her ankles, both swollen, by afternoon every day. She described walking as moving through wet concrete, getting up from a chair as something that required a moment of preparation. I asked to see the green notebook. There it was. Every single morning without exception, 1 cup of mixed tropical fruit, pineapple, mango, watermelon, and a large glass of orange juice on the side. She was doing everything she had been told was right. And something in that perfect routine was quietly strangling the circulation in her legs. I am going to come back to Margaret. What happened over the next 14 weeks? I want you to hear that. But first, I need to show you exactly what was happening inside her body. Think of the blood vessels in your legs as garden irrigation hoses. When you are young, those hoses are flexible, wide. Water moves through easily, even at lower pressure. After 60 years of use, those hoses begin to stiffen. the inner lining becomes thinner, more sensitive, more reactive to changes in what flows through them. Now imagine pouring a concentrated sugar solution through those stiffened hoses 3 times a day, every day. The inner lining reacts. It swells slightly with each spike. Blood flow narrows. Your legs, already fighting gravity from below, does receive less and less oxygen with every heartbeat. That is what certain fruits do to the aging circulatory system. Not because fruit is toxic, because the aging body handles fruit sugar completely differently than the body that those nutrition guidelines were designed for. And here is something I want you to hold in your mind. Number one on this list. The most damaging of all 7 is a category that sits in nearly every senior's pantry. It is the one that surprises people most when I explain it. We are going to build to that. Stay with me. Number 7, watermelon. I know what you are thinking. It is 92% water. It is refreshing. It is summer. How could watermelon possibly be a problem? Here is what the label does not tell you. Watermelon has one of the highest glycemic indexes of any fruit, 72 out of 100. To understand what that means practically, white bread scores 75. Eating 2 cups of watermelon, a completely normal serving size, triggers a blood sugar response that is almost identical to eating 2 slices of white bread. Now, here is why that matters specifically for your legs. And this is something I need you to pay close attention to. After 60, the tiny blood vessels that feed your lower limbs lose their ability to self-regulate under sugar stress. This is a normal change of aging. It is also a change that nobody explains. A 2019 study in the Journal of Clinical Endocrinology and Metabolism followed adults over 65 for 24 months. All of them had normal fasting blood sugar. None of them had diagnosed diabetes. The study found that repeated blood sugar spikes above 140 milligrams per deciliter from any food source caused measurable reduction in lower limb microcirculation. Measurable. Documented. In people whose routine lab work showed nothing unusual, 140, that is the threshold. And 2 cups of watermelon pushes most adults over 60 straight through it. The result shows up as heaviness in your calves by early afternoon, swelling around your ankles that appears even on days when you have been sitting still. That dull ache behind the knees that you have blamed on the weather or on sleeping wrong, you were not sleeping wrong, you were having breakfast. Now, I need to be crystal clear about something. If you are taking blood pressure medication, particularly calcium channel blockers or ACE inhibitors, elevated blood sugar from high glycemic foods can create unpredictable pressure swings throughout the day. This is a conversation to have with your doctor before you make changes. And if you are taking diuretics for fluid retention, watermelon's combination of high water content and blood sugar spikes can actually worsen the ankle swelling you are trying to control. Talk to your doctor first. Number 6, pineapple. Pineapple has a reputation that its chemistry only partially deserves. Most people have heard of bromelain, the enzyme in pineapple with anti-inflammatory properties. And bromelain does have real anti-inflammatory effects. That part is true. But here is the part that is almost never explained. Bromelain is also a significant blood thinner. A 2021 review published in the journal Nutrients examined bromelain's interactions with common medications in older adults. It found that the amount of bromelain in just 2 to 3 slices of fresh pineapple significantly enhanced the anticoagulant effect of aspirin, warfarin, and other blood-thinning medications. Now, I need to stop here because this interaction matters enormously. If you take daily low-dose aspirin, even 81 milligrams, eating pineapple regularly can push your blood-thinning levels into territory your body was not designed to handle. Unusual bruising, cuts that bleed longer than expected, and in some cases, internal bleeding with no obvious external sign. This is not a theoretical risk. It is a documented interaction that appears in the literature repeatedly for this age group. Beyond the medication question, pineapple is highly acidic. And acid in the aging digestive system does not stay where it belongs. It enters circulation and creates microinflammation in the inner lining of blood vessels. That inner lining, called the endothelium, is already more fragile after 60. Repeated acid exposure creates low-grade inflammation that settles into joints, into the knees, into the hips, into the space around the ankles. You feel it as morning stiffness that takes longer and longer to loosen, tightness in the calves after standing for 20 minutes, unexpected pain in the big toe that comes and goes. If you take warfarin, aspirin, Eliquis, or Xarelto, do not increase your pineapple intake without explicitly discussing it with your doctor or pharmacist. This is safety information, not optional caution. Let me come back to Margaret now. This is where her story becomes important for you specifically. I look carefully at her green notebook. 7 days of precise records. Every morning, the same breakfast. Pineapple, mango, and watermelon with a large glass of orange juice. Then, I asked her something. Are you on any blood thinners? She said yes. Low-dose aspirin, daily. For 6 years, I asked, has anyone ever explained to you that pineapple has blood-thinning properties that interact with aspirin? She looked at me for a long moment. Then she said, no. No one has ever mentioned that. Her doctor had 7 minutes per visit. Her pharmacist had given her a printed information sheet she had never read. The guidelines said pineapple was healthy. Nobody had been in a position to connect those 3 things together. I asked her to remove the tropical fruits from breakfast for 3 weeks. Just 3 weeks. Keep the green notebook. Record everything. She crossed her arms slightly. She said, these are healthy foods. Every article I have ever read says so. I told her, I understand completely. And I told her, your notebook is going to tell us the truth. Not me. Your notebook. I will come back to what her notebook showed. But right now, let me show you number 5. Number 5, mango. This one surprises people because mango feels light, refreshing, natural. Nothing about eating a mango feels like doing something harmful. Here is what the nutrition label does not tell you. 1 cup of diced mango contains 25 grams of natural sugar, 25. To put that in context, that is more sugar than many sodas carry, without carbonation to slow absorption, without significant fiber to buffer the blood sugar impact. And here is the mechanism I want to explain carefully, because this is the part that most people have genuinely never heard. After 60. So the nerves in your legs become increasingly sensitive to something researchers call glycation damage. Glycation is what happens when sugar molecules attach to proteins in your nerve fibers. Slowly, silently, over time. It does not happen from one meal, but from repeated high sugar exposure. Several times each day, the nerve fibers running through your calves and feet begin to stiffen. They lose their ability to send clean signals. Blood flow regulation in the small vessels becomes less precise. The result you feel is pins and needles in your feet at night, a burning sensation that starts at the toes and moves up, numbness that makes walking feel like you are stepping on someone else's feet, a heaviness that no amount of rest seems to fully resolve. A 2020 study in the journal Diabetes Care followed adults over 65 who did not have diagnosed diabetes. Those with the highest daily fructose intake from fruit sources showed measurable early nerve conduction slowing in the lower extremities after just 18 months. 18 months in people with completely normal fasting blood sugar. This is not diabetes. This is the quiet damage that in many people precedes a diabetes diagnosis by 5 to 10 years. Now, if you take metformin or any form of insulin, this matters for your daily routine. Mango's sugar load can create spikes that interact unpredictably with medication timing. If you take your medication at a fixed time and then eat mango 45 minutes later, the medication and the fruit sugar can work against each other. Blood sugar may first drop below comfortable levels, then spike above them as the mango hits. Discuss timing specifically with your prescribing doctor before making changes. And if you have any early symptoms of peripheral neuropathy, burning feet, tingling, unexplained numbness, eliminate mango from your daily intake and bring it up at your next appointment, even if your recent blood sugar tests were normal. Number 4, grapes. Small, easy, sitting in a bowl on the counter. You eat a handful, then another. Before you have finished thinking about it, you have had 2 cups. Here is the problem with grapes that nobody takes the time to explain properly. Grapes contain very high levels of fructose. And fructose, unlike regular glucose, is processed almost entirely by your liver. Your liver converts it into 2 things, fat, and uric acid. In younger adults, the liver handles this efficiently and clears the uric acid quickly. But after 60, liver processing capacity slows by approximately 30%. Uric acid builds faster than your body can clear it. Where does excess uric acid end up? It crystallizes in your joints, and it seeks the coldest, most peripheral joints in your body first. Your big toe, your ankle, your knee. You feel this as a sudden sharp pain in the big toe at night, with no obvious cause. A warmth and swelling around one ankle that appears for a day or two then disappears. Knee stiffness that is worst in the first 20 minutes after waking up. Most seniors never connect any of this to grapes. They attribute it to the weather, to sleeping wrong, to just getting older. Meanwhile, they have grapes in the refrigerator every day. A meta-analysis of 12 studies published in Arthritis and Rheumatology found that adults over 60 who consumed more than 1 cup of high fructose fruit daily had a 44% higher risk of gout flares compared to those choosing low fructose alternatives. 44% from fruit that everyone calls healthy. Now, if you take diuretics, water pills for blood pressure or for swelling, pay close attention to this. Diuretics slow uric acid excretion through the kidneys as a known side effect. Eating high fructose fruits like grapes while on diuretics significantly accelerates uric acid accumulation in your joints. This combination can trigger gout in people who have never experienced it before. If you have had even one gout attack, limit grapes to no more than a quarter cup per sitting and avoid them entirely on days when your joints feel inflamed. Bring this interaction to your doctor. If this information has genuinely surprised you, and I think for most of you it has, hit the like button right now. It takes 1 second, but the algorithm will show this video to other seniors who are suffering and have no idea why. You could be the reason someone finally gets the answer they have been looking for. Number 3, bananas. I need to take this one carefully because bananas have a reputation built on something real, and I am not here to dismiss what is real. Bananas are high in potassium. This is true. Potassium is essential for muscle function, including the muscles in your legs and calves. That part of the reputation is legitimate. Here is what changes after 60, and this is the part the guidelines never updated. Bananas are also very high in fast-digesting carbohydrates. One medium banana carries approximately 27 grams of carbohydrate with relatively little fiber to slow the sugar impact. Your body processes it quickly, blood sugar rises, then falls, then rises again when you eat the next piece of fruit an hour later. This cycle, repeated daily, trains your muscle cells to become progressively resistant to insulin. And insulin resistance does not just affect your blood sugar numbers. It changes how efficiently your muscle cells absorb nutrients, including the very potassium that bananas are supposed to deliver. The thing you are eating the banana for becomes increasingly unavailable to the cells that need it most. And here is the interaction that most concerns me for this age group. If you take an ACE inhibitor for blood pressure, lisinopril, enalapril, ramipril, perindopril, your kidneys already retain more potassium than normal as a direct medication side effect. This is well documented. Eating bananas daily on top of ACE inhibitor therapy can push your potassium to levels that cause muscle weakness, irregular heartbeat, and in serious cases, cardiac events. This is one of the most consistently under-discussed drug-food interactions affecting seniors. It is real, it is documented, and very few people have ever been warned. I am not telling you never to eat a banana. I am telling you to bring banana consumption up explicitly at your next appointment if you take any ACE inhibitor. Ask your doctor to check your potassium level. A simple blood test. It could change how you eat breakfast tomorrow. Let me come back to Margaret. 3 weeks have passed. She walked back in, carrying the green notebook. She sat down. Before I could say good morning, she said, "Doctor, I owe you an apology for doubting you." Now, let me be honest with you. The first 3 days were difficult for her. She had her usual breakfast, but without the tropical fruit bowl and without the orange juice. 2 eggs, half an avocado. She felt deprived, a little irritable. On day 2, she wrote in her journal, "This is not sustainable. I miss my breakfast." Day 4, she wrote something different. "The swelling in my left ankle seems slightly less by evening." Probably coincidence. Day 7, she wrote, "I walked to the end of the street and back without stopping. I have not done that in 4 months. By day 14, one line. The concrete feeling in my legs is gone. She was not cured. She was not finished. But something real had shifted, and she wanted to understand why. I will tell you what happened to Margaret over the next 5 months. But first, number two, because this is the one that my patients argue with me about the longest. Number two, orange juice. I want to be very specific here. Not oranges, orange juice. This distinction is critically important, and the food industry has spent decades blurring it. When you eat a whole orange, the fiber in the fruit slows sugar absorption dramatically. Blood sugar rises gradually. Your circulation handles the curve smoothly. When you drink orange juice, even freshly squeezed, the fiber is essentially gone. 12 ounces of standard orange juice delivers approximately 36 grams of sugar with almost no fiber to buffer it. Your blood sugar spikes within 15 minutes at a rate nearly identical to drinking a sugar-sweetened beverage. But here is the piece that applies specifically to leg circulation, and this is what most people have never heard. The citric acid concentration in orange juice, at the level found in a standard morning glass, has been shown to increase inflammatory markers in the endothelium. That inner lining of your blood vessels, the same fragile layer we have talked about throughout this video. A 2018 study published in the American Journal of Clinical Nutrition measured endothelial inflammation markers in adults over 60 after consuming different breakfast beverages. A single serving of orange juice elevated inflammatory markers measurably more than eating a whole orange in the same subjects. Same fruit, different form, different response. That inflammation shows up in your legs as stiffness in the hips that is worst after sitting, swelling around the knees by mid-afternoon, calves that ache persistently without an obvious explanation. Now, if you take statins for cholesterol, simvastatin, atorvastatin, rosuvastatin, orange juice shares certain metabolic pathways with grapefruit in terms of how it can affect medication processing in some individuals. This varies significantly by person and by specific statin, but it is worth raising with your prescribing doctor if you drink orange juice daily and take a statin. The replacement is simple. Eat one whole orange instead of a glass of juice. Get the fiber, get the vitamin C, protect the lining of your blood vessels at the same time. And now, Margaret, 5 months after that first visit, her daughter called me. She said, "Dr. Kent, I wanted you to hear this. My mother walked through the entire farmer's market with us last Saturday, the whole market, without stopping once. She stopped to look at things, but she chose to stop, not because she had to." Margaret sent me a note that week. She wrote, "I spent 3 years blaming my age for what my breakfast was doing to my legs. I am angry that nobody told me sooner, but I am grateful that someone finally did." Her ankle swelling reduced by approximately 70% based on her own morning measurements over 14 weeks. Her morning leg heaviness gone on most days by 8 in the morning. Her walking distance before needing to stop more than doubled. Now, I need to say something important here. Margaret's results were on the better side of what I typically see. Your results may be different. Some people see changes faster, some slower. The timeline varies. What does not vary, in my experience and in the research, is the direction. And now, number one, I told you at the beginning that this one would surprise you. I told you it was probably already in your kitchen. Number one is not a single fruit. It is a category. And it is in almost every senior home in the country. Dried fruit and concentrated fruit juice, raisins, dried cranberries, dried apricots, dates, trail mix with dried mango or dried papaya pieces, fruit and nut bars, and any juice labeled 100% fruit, even the ones with no added sugar. Here is why this category is the most damaging of all 7. Drying fruit removes the water. It concentrates everything that is left. 1 tablespoon of raisins contains the same sugar load as approximately 40 fresh grapes. 40. Most people eat 3 to 4 tablespoons in what they would call a small handful. But the sugar concentration is only part of the problem. And this next part, this is what nobody tells you. Most commercially sold dried fruits are treated with sulfites, preservatives used to maintain color and extend shelf life. Sulfites trigger inflammation in the walls of blood vessels, in the airways, and in adults over 60, with any degree of vascular sensitivity, sulfite exposure has been associated with measurable increases in blood pressure and lower limb swelling within 2 to 4 hours of consumption. A 2023 analysis published in Food and Chemical Toxicology examined sulfite levels in the most commonly consumed dried fruits, raisins, dried cranberries, dried apricots. It found that sulfite concentrations exceeded amounts that triggered measurable inflammatory responses in a clinically significant subset of adults over 65. And then, the glycemic impact on top of the sulfite inflammation. Dried fruit has one of the highest glycemic indexes of any food category. Some varieties score above 90, higher than most candies, higher than white rice, higher than a glazed donut. You reach for a small handful of trail mix at 10 in the morning. You think it is a smart snack, healthy, natural. In the next 20 minutes, your blood sugar spikes to levels that narrow the microcirculation in your legs. The sulfites add a layer of vascular inflammation on top of that spike, and you wonder, why do my legs feel so heavy by noon? This has been happening in kitchens across the country for decades, and nobody connected it to the trail mix on the counter. Now, drug interactions for this category are serious. If you take any blood sugar medication, metformin, glipizide, any form of insulin, do not use dried fruit as a snack without your doctor's specific input. The concentrated sugar can overwhelm medication timing and create significant instability in your blood sugar throughout the day. If you take warfarin, some dried fruits contain high concentrations of vitamin K, which directly interferes with your INR levels. This is not theoretical. This is a documented interaction that your pharmacist needs to know about. If you are using dried fruit regularly, replace dried fruit completely with fresh whole fruit from the list I am about to give you. And replace fruit juice, all of it, with water with a squeeze of fresh lemon or a few slices of whole fruit. Now, you know all 7. And knowing what to remove is only half the answer. Your legs need specific nutrients, and there are fruits that actively support leg circulation, reduce joint inflammation, and do not create the blood sugar spikes that damage the vessels that feed your lower limbs. Here is your replacement protocol. Specific amounts, specific timing. First, wild blueberries. Not regular blueberries if you have access to the wild variety. Wild blueberries contain significantly higher concentrations of anthocyanins, the compounds that directly support flexibility in blood vessel walls. Half a cup. Fresh or frozen, before 10 in the morning. Combined with a protein source, 2 eggs, Greek yogurt, or a small serving of cottage cheese to buffer any sugar impact. A 2021 randomized controlled trial in the British Journal of Nutrition found that daily wild blueberry consumption in adults over 60 reduced blood vessel stiffness markers by 29% over 12 weeks. 29% from half a cup of blueberries. Second, Tart cherry concentrate, not sweet cherry juice. Tart, specifically Montmorency Tart cherries. 2 tablespoons of concentrate mixed into a glass of water every morning. Tart cherries contain naturally occurring compounds that directly reduce uric acid levels in the blood. This addresses, at the source, the gout and joint inflammation that grapes and high fructose fruits create. If you cannot find Montmorency concentrate, 10 to 12 fresh tart cherries, not sweet cherries, will provide similar benefit. Third, have an avocado daily, after breakfast, not on an empty stomach. Avocado contains healthy monounsaturated fats that reduce the chronic low-grade inflammation in blood vessel walls. It also contains more potassium per gram than a banana, without the blood sugar spike that makes banana potassium difficult for aging muscles to absorb. Fourth, 1 whole kiwi fruit with protein, not on an empty stomach. Kiwi contains a unique combination of vitamin C and an enzyme called actinidin that supports healthy blood flow and does not create the citric acid spike that orange juice does. 1 fruit with breakfast, not as a standalone snack. This is your protocol. 4 items, specific amounts, specific timing, affordable, available at any grocery store. Now I need to set your expectations correctly, because what happens in the first 7 to 14 days is going to determine whether you continue or whether you stop. Week 1, you are going to miss the sweetness. Your palate has been conditioned by years of high sugar fruit every morning. The first 3 to 5 days, your body will ask for it. You may feel slightly flat, slightly low energy in the morning. This is temporary. It is also a sign that the reset is working. I am not going to pretend week 1 is easy. It is not. But here is what is actually happening during that week. Your blood sugar is beginning to level out. The peaks that have been narrowing your leg circulation every morning, they are getting smaller. Your body is recalibrating. Week 2, most people begin to notice something subtle. The swelling that has been your constant companion by afternoon, it is slightly less by the end of week 2. Not gone, less. Your calves may feel marginally lighter when you get up in the morning. Week 3, this is the week I point toward with every patient. 3 weeks is when the pattern becomes undeniable. The morning stiffness that you have been attributing to age, it starts lifting earlier. The concrete feeling that Margaret described begins to lift. Not everyone, not every case, but enough that week 3 is consistently the turning point in my experience with patients following this protocol. Week 4 and beyond, changes become consistent and accumulating. The morning that you wake up and realize your ankles look normal, that day comes for most people who stay with the protocol through week 3. Most people quit after 4 days. They feel the absence of sweetness and go back to the tropical fruit bowl. Here is what happens if you push past day 21. Your taste preferences shift. The craving for that specific sweetness changes, and the number of people who go back to dried fruit and orange juice after experiencing legs that work properly again is very small. Is 3 weeks of adjustment worth walking through a market without stopping? Asked Margaret. Today, you have done something that most seniors never do. You have sought out better information. You have listened to something that challenges what you have been told for 30 years. And you have given your legs a fighting chance. Here is what you understand now that you did not understand when you sat down. You understand why the guidelines failed you, written for a different age, never updated for yours. You understand the 7 fruits that have been quietly working against your circulation, and you understand exactly what to replace them with and when, and how much. The next step belongs to you. Type I finished in the comments right now if you watch this to the end. Your comment does 2 things. It tells me this information reached you, and it shows the algorithm that this video matters. So it reaches someone else who needs it today. And then send this to one person. One. Your spouse. A friend who mentions their leg pain every time you see them. Your adult child who is watching their parents struggle to walk up a porch step. You do not need to say anything. Just send the video. You could change the direction of someone's health with one share. Not tomorrow, today. Subscribe and turn on the bell. Because next week, something genuinely disturbed me when I first read this research. There is one habit that almost every senior over 60 does every single morning without thinking about it at all. And a 2024 study tracking over 9,000 adults found it may be the single most damaging thing you can do for your circulation before 8 in the morning. It is something you do every day. You have no idea it is a problem. That is next week. References for every study I mentioned today are in the description below. Journal name, year, searchable on PubMed. Print them out. Bring them to your next appointment. A doctor who welcomes that conversation is the right doctor for this season of your life. Everything I shared today is based on published research and clinical patterns like Margaret's. Her story represents a composite of experiences I have seen repeatedly in practice. Always confirm changes with your personal doctor before modifying your diet or supplement routine. Your individual health history matters. This information is the start of that conversation, not the end.